Epilepsy is a neurological condition where a person has a tendency to have seizures that start in the brain. The brain is made up of millions of nerve cells that use electrical signals to control the body's functions, senses and thoughts. If the signals are disrupted, the person may have an epileptic seizure, sometimes called a fit or an attack. Epilepsy can start at any age, including childhood. In the UK, there are an estimated 112,000 children and young people in the UK with epilepsy. This programme will give an introduction to how epilepsy can affect children and young people. It also includes specific information for parents and healthcare professionals. In this programme, we hear the views of Professor Helen Cross, Professor in Paediatric Neurology at Great Ormond Street Hospital for Children, who gives practical advice for those caring for a child or young person with epilepsy. Vanessa Newman, independent epilepsy nurse, discusses the current state of care for epilepsy in the UK and how the treatment of patients can be improved. We also hear from David Ford, Chief Executive of Young Epilepsy, the only national charity working exclusively on behalf of the 112,000 children and young people in the UK with epilepsy. Ashley Burton, Product Manager at MFIT Limited, gives an insight into his company's epilepsy monitoring innovations. Thierry Darcy, General Manager at ViroPharma Europe, discusses his company's commitment to the treatment of epilepsy, especially to the use of emergency medication in children and young people, which is required when they suffer seizures. And finally, Louise Cousins, spokesperson from Epilepsy Action, explains how the charity acts as the voice for the UK's estimated 600,000 people with epilepsy.
Epilepsy Action is the largest member-led epilepsy organisation in the UK, and we do everything that we can to support the 600,000 people with the condition across the country, including their friends, families and carers as well. We campaign for better epilepsy health services and we raise awareness of the condition. We also provide a national network of local support groups. We fund epilepsy specialist nurses. We hold regional conferences and we have free phone and email helplines as well.
Young Epilepsy is the only organisation working exclusively for young people with epilepsy. We are particularly concerned to campaign, to raise awareness and understanding. In particular, within the education system, we believe there's a great deal more that can be done to support children and young people in school and in college to help them achieve the very best outcomes that they can. Our other area of big concern is the NHS healthcare service. Often it's inconsistent and often children aren't seeing physicians of the right sort of expertise or receiving the service that they require.
Here at Young Epilepsy, we work to support children and young people with epilepsy from across the UK, along with their parents and carers. They very often come to us in the first instance via our helpline, where we offer them information and a range of resources that can help them to understand this complex condition. We're fortunate to have a world-class medical facility at our headquarters in Lingfield, Surrey, where we conduct diagnosis, assessment and treatment services for children and young people with epilepsy from across the UK. Our consultant team all have links with Great Ormond Street Hospital and University College Hospital. Led by Professor Helen Cross, the Prince of Wales Chair in Childhood Epilepsy, the team are involved in groundbreaking research into children and young people with epilepsy.
Epilepsy is a condition where individuals are prone to recurrent epileptic seizures. An epileptic seizure is a change in movement or behaviour, the direct result of an electrical change in the brain. They're unpredictable, they can occur at any time. The problem we have is that epilepsy is not a single condition, it's a symptom, and there are many different causes. It is particularly prevalent in young children, especially very small children, with around 80 per 100,000, and the incidence goes down as children get older into adulthood to around 40 to 50 per 100,000.
Alec's diagnosis of epilepsy has been quite a long journey for us. He had his first seizure at the age of 3 months, and then he didn't have another till the age of 5 months. At the age of 5 years old, his seizures changed and we were then diagnosed with proper life-threatening epilepsy. I was absolutely devastated, basically didn't know where to look, where to go from there. But on the whole, I just have to basically stay strong for Elliot, for the fact that, you know, each day we might not actually have him. St Piers School has provided Elliot with an education tailored to meet his needs. It has everything that Elliot needs under one roof, with all the therapists that are involved with Elliot. They are approachable, they give me advice when I actually need anything. The school provides Elliot with a lot of resources that he wouldn't receive if he was at a mainstream school.
The main thing really is that I haven't been able to take my health for granted anymore, sort of having to take regular medication in a way. It's sort of, you know, I've never had to do anything like that before. It's having to, you know, visit a neurologist fairly regularly. It has been quite frustrating in a way. Also, yes, losing my driving licence. I was literally about 2 weeks after I had my first seizure, I was due to take my driving test, and I was quite confident I would have passed, but now I've had to give up my driving licence. I still aren't able to hold a driving licence legally. It's also had sort of future implications for my career, because at the time I was very interested in joining the police, and I still am to an extent, and it has sort of raised questions about whether that would make that less likely, whether that would be less possible in the future. But I mean, overall I am quite lucky. It is well controlled, but it is something I always have to bear in mind.
When an individual's been diagnosed with epilepsy, the first line of treatment that is considered is medication, anti-epileptic medication. There is a range of different medications, some known to be more suitable for certain types of epilepsy than others, and the type of medication will be selected on that basis, on the basis of the diagnosis of the type of epilepsy. The medication suppresses the tendency to have seizures. It doesn't take away the underlying cause, and therefore it's not like a course of antibiotics whereby you take the course and the infection goes away. With epilepsy, you have to keep taking the medication in order to prevent the seizures. Dependent on the type of epilepsy, there may be a tendency to grow out of it, so in time it may be that medication can be weaned if they've been seizure-free for a period. But actually in many cases, particularly if the epilepsy comes on in teenage years, the medication will be required long-term. In a certain number of individuals, surgery may be an option, but in others it may be that dietary treatment may be an option, or in some, where epilepsy is quite complex, vagal nerve stimulation.
We've done a lot of work to produce information. There's a huge need both amongst professionals, amongst parents and young people themselves to really understand epilepsy. It's something that a lot of people know of but don't know anywhere nearly enough about.
The vast majority of my friends and people I've encountered have been perfectly fine with it. It's never ever been an issue. My best friend, for example, is a medical student and she actually wants to be a neurologist, so it has been quite useful for her to sort of ask me questions about it. I think the majority of people who sort of have an issue with it, it isn't because of any discrimination or any prejudice towards it. It's mainly just because of a lack of knowledge. For example, last year I went to a nightclub and it had a lot of strobe lights, and my friend was sort of, oh gosh, you know, are you going to be okay? Is it going to be fine? And it's sort of, a lot of people just assume that the majority of epilepsy cases are caused by flashing lights, which is not true at all. My family have, as the years have sort of gone on, it's been about 2 years now, have become a lot better. They're not as overprotective at all. You know, moving to London has been a big step, and it would potentially, you know, worry them, but they've been fine about it. It rarely mentioned with my family.
We do try and do normal things like other families, but again, as I said, we live for each day. We wake up and then we actually decide we can't actually plan anything anymore, you know, to go out, because, you know, quite often I plan something and I'm not able to do it for the fact that Elliot's epilepsy has affected it, you know, affected us, that we can't actually go out. You know, I do feel quite supported, really. I have very good health professionals involved with Elliot that are at hand whenever I actually need advice or I'm not quite sure about something. I also get quite a lot of advice from the health professionals at Young Epilepsy, who also yeah, are at hand whenever I actually need any advice and are quite willing to help.
Epilepsy is not a single diagnosis. More accurately, we should call them the epilepsies. There are many different types of epilepsy and many different causes. And indeed, we are gaining an increased understanding of the different causes of epilepsy, which will hopefully lead us to better treatments. If seizures are continuing in a child and it's really not clear the underlying diagnosis or cause, then the family should have the opportunity to discuss the epilepsy with a tertiary expert with regard to the condition. And in children, this would be a paediatric neurologist with an expertise. In adults, an adult neurologist. This is so that we can give them as much information with regard to expectations as possible and make sure that they have been trialled on the appropriate treatments.
Young epilepsy is particularly campaigning for change in the areas of health and education and the provision of information. In health, we are very determined to develop a new care pathway for children with epilepsy so that they are seen by the doctors and experts of the right level of expertise, so that they're receiving the very sort of particular care and treatment that is appropriate for them. At the moment, this is really inconsistent. And in schools, we know that there is research to show that something like 50% of all children with epilepsy don't achieve their full potential in school. Often their needs are misunderstood. The teachers and care staff don't know how to support them properly. So we're doing a huge amount of work to try and raise the understanding amongst teachers and support staff in school to better see children achieve in school. So all of this means that this all has to be backed up with really high quality information, and either we as an organisation can provide that, or we can signpost people onto where they can get the right sort of information that they need. Young Epilepsy is here to help our professional colleagues within the health service. We have a fantastic range of diagnostic, of assessment and treatment facilities. We have a lot of information. We are determined that epilepsy shouldn't be a barrier to any young person in achieving the outcomes in life that they want. We know that with the right help, with the right support and the right treatment, many young people can achieve great things despite their epilepsy. So whether it's information, whether it's training, whether it is support, I think Young Epilepsy has a great deal to offer. We can be contacted through our helpline or through our website at youngepilepsy.org.uk.
Yeah, Abby was our only child. She wasn't diagnosed with epilepsy till she was 5-year-old, so and it was only a mild form of epilepsy. She would have maybe one seizure a year up until, I think it was November 2006, wasn't it? And they started to get worse, so we took her back in, and they put her on medication, and she was on medication for her seizures. We'd managed the seizures before that for 5.5 years, hadn't we? Yeah. And everything was going well, but like I said, she was on the medication for 11 weeks. And on the 1st of December 2006, Abby passed away in a sleepless sudden unexpected death in epilepsy. Something that we weren't warned about when she was diagnosed with her epilepsy. So it was a massive shock to me and Tracy. I mean, Abby was everything we wanted. She was an only child. We wanted it that way. We were going to spoil her. She got everything she wanted, and she was such a loving, happy kid. It's devastating that epilepsy can do this to somebody when you think in yourself that it's only a seizure, and sort of something you're not told about. It's a massive shock, isn't it? Yeah. So after we'd lost Abby, the following year, 2007, we decided to set up a charity in Abby's name and call it Abby's Love, because of like the love Abby showed for everyone, her family and her friends. It was an appropriate name, wasn't it? Yeah. Anyway, we set that up in May 2007.
Become a registered charity. Yeah,
we started off with a charity walk, and there was over 140 people, and we raised £7,000, which was good to start, wasn't it?
Yeah. Abby's Love gets a lot of support, a massive amount from our local people in Middlesbrough. We couldn't thank them enough, and it keeps us being able to do what we want to do in Abby's memory.
Sudden unexpected death in epilepsy is something that me and Trace knew very little about and nothing about at the start. But there is ways to reduce the risk, and one of the ways is obviously with the MFIT alarm bed. I mean, that's the biggest thing about having a seizure is being there at the time, and obviously with the alarm bed it lets you go to sleep, and if anything happens you're up, you're alerted, you can get an ambulance, you can be there to sort things out, whatever needs sorting out, and it's a massive plus just being able to do that. I wish it was something that we'd had for Abby, because obviously me and Tracy just spent a lot of our time. If we heard a creak, a noise, we would be up and in her room, and obviously if we'd had the bed, this crosses our mind all the time that if we'd have had one of these MFIT seizure beds, that maybe Abby would still be here.
Abby's Love charity supplies alarm beds for children in our local area who have nighttime epilepsy. Most of the children's names are given to us off our epilepsy nurse. We get in touch with the families, or they'll ring us, and what we do, they can come to us and we demonstrate how the alarm bed works, or we will go out to the home and fit the alarm bed in. And we keep in regular contact with the parents and children. We've made like friends of them, and most of them, well all of them, are so happy with them, giving them that bit of peace of mind. They can sleep on a night knowing if the child does have a seizure in the night, this alarm bed will alert them and they can be there with the child.
We have provided the MFIT tonic-clonic seizure monitor to the Abby's Love charity. They were looking for a solution suitable for the family home. The kit contents are an under-mattress bed sensor. This attaches to the MFIT control unit. We then attached a wireless transmitter to the MFIT control unit. This would then raise an alarm should the child have a tonic-clonic seizure and alert the parents in another room within the same property. We have a range of solutions available depending on the number of users. For example, in a family home, we could provide a solution where the carer is alerted in a separate room to the person using the equipment. We also provide a solution for organisations such as learning disabilities, where a number of clients may be in the same property. In this instance, it would be good to utilise the equipment with a staff pager. This would clearly identify to the staff member which of the alarms had been activated. The MFIT tonic-clonic seizure monitor is very simple to install. Simply lift up the mattress on the existing bed and place the bed sensor on the bed base. Attach the bed sensor to the control unit, activate the control unit, and the alarm is ready to use.
MFIT was founded 22 years ago in Finland. The starting point of our business was the MFIT film invented by us. Through extensive product development, MFIT film has become the technological foundation of our company. The technical cornerstone for us was the development in the late 1990s of our patented gas diffusion technology we use in our sensor film production. In 2000 we began development on application electronics for elderly care, and soon afterwards for tonic-clonic seizure monitors, and then non-body contact vital signs monitoring. In summer 2011, after many years of development, this non-body contact vital signs measuring system was approved and got the EC certificate as Class 2A medical device in Europe. This technology platform we now are developing also for the future benefit of people with epilepsy. We are now working on it that in coming years it could be used to detect also non-convulsive seizures, based on detecting changes in heart rate variability and respiratory rate.
I'm 22-year-old. And when I was 9, I was diagnosed with leukemia. 3 months into my treatment, I suffered a stroke due to a chemo that went in my spine to my brain. I finished treatment in 2000. In about 2001, I started having different issues and finally got diagnosed with epilepsy. Got put on all medication, but my epilepsy, I don't come out with my seizures now. So I need to be given some special medicine to bring me out of my seizures. I got donated an alarm by Abby's Love, by Richard and Tracy. It's helped us a lot me and my family, because I feel more at ease when going to bed. We knew Abby as my brother went to school with her. We'd saw Abby's story in the paper and got in touch with Richard and Tracy about the alarms, and they donated me an MFIT alarm, which has changed our lives.
My daughter Emily, she's 13 years old. She was diagnosed with epilepsy just over 2 years ago. Before we had the bed alarm, we were using baby monitors, which were really not very effective. Kept us awake most of the night because you heard every single noise, so it didn't really give us much peace of mind. But as I say, since getting this, it's just been wonderful. It's just been fantastic for us.
SUDEP indeed is a tragic problem, but awareness is thankfully increasing. We at MFIT, with our 16 years of experience in healthcare, are determined to help people avoid unnecessary losses of their loved ones.
In Europe, we are commercializing 3 products for the moment, and these 3 products are exactly in the area we are interested in: high unmet medical need, innovative, and meeting patients' needs and carers' needs. ViroPharma is committed to bring new products to unmet medical need areas, and epilepsy is one of these areas where new products have not been brought forward for quite a while in acute seizure management. We have brought a new therapy to this area just recently, and so we're very excited today to bring this new therapy to the patient.
NICE updated the guidelines for the diagnosis and management of epilepsy in 2012. This incorporated information on new drugs being available to healthcare professionals, and also on information how to manage emergency care of patients with epilepsy. Prolonged seizures are seizures lasting longer than 5 minutes. It is important to treat these seizures as quickly as possible after this time point to avoid any detrimental damage to the brain, especially through lack of oxygen. The guidelines also state that emergency care should be given to children, young adults and adults if they are continuing having prolonged seizure activity. ViroPharma is committed for patients, carers and healthcare professionals to have up-to-date information on new drugs being available. To this end, ViroPharma provide training and education and resources for healthcare professionals to disseminate to carers and patients to ensure that they use our drugs appropriately and with confidence.
I feel that epilepsy care has progressed actually a lot over the last 25 years or so. Epilepsy's had its fair share of stigma, neglect. It's never been that sort of in the media top-notch sort of condition. We've progressed because we have now these trained specialists. We have nice guidelines about epilepsy, and we have better diagnostics for epilepsy, so we can get patients in to see the right specialist, to have the right test, and hopefully get people diagnosed and receiving treatment a lot quicker than we used to. Historically, for emergency seizures, we've used in the UK rectal diazepam, and I understand that's still used in Europe today. Although more recently in the UK, we've been using buccal midazolam, which is an alternative. And now I understand that since the 2012 NICE guidelines, they've now recommended buccal midazolam as a first-line treatment for emergency seizures. The most important things for using rescue medication in the community, or buccal midazolam in the community, is that the healthcare professionals, the prescribers, feel confident enough to prescribe the medication. And I think it's imperative that they get educated and trained in how to use the medication, but more importantly, why? Because we do know that emergency medications are life-threatening. The other thing is that the patients themselves and the carers understand how to effectively administer the drug, the dosage of the drug, so that they also have confidence in using it in the community. Treating prolonged seizures is really important because these prolonged seizures carry a risk of fatality. Therefore, making sure that the patient is prescribed a rescue medication, for example buccal midazolam, reduces the risk of this essentially fatality. It's also important to educate the clinicians who prescribe the medication, because historically they've only been aware of the rectal diazepam, and then now we're providing something new. It's not necessarily new, but to GPs it's a new product. So providing them with training about the product, providing them with the background information about epilepsy and prolonged seizures and the danger that it holds is really important before actually prescribing the patient the drug. Now, if the patient is prescribed buccal midazolam, it's important that someone, whether it's the clinician or a nurse, trains the patient, educates the patient about the drug, why we're using it and why it's important to use it.
At ViroPharma, we really believe in making a difference for patients and patients' lives. And as part of that, it's also their families and making their lives easier, and also the people that look after them, so the doctors and nurses that are actually caring for those patients. I think it's really important for doctors and nurses and carers to have full confidence in buccal midazolam and in the product that they're using to treat seizures. They understand the seriousness of the condition, and it becomes vital then to make sure that they're actually administering the drug properly, and in turn so that they can pass that message on to families and other people that are caring for children with seizures.
There are lots of things that healthcare providers can do to help children and young people with epilepsy. It's vital that children and young people are diagnosed quickly and by a doctor who is a specialist in epilepsy. This way they can be put on a treatment path as soon as possible, with the ultimate aim of having their seizures controlled. They should also be regularly reviewed, again by somebody who is an epilepsy specialist, and if their current medication isn't controlling their seizures, doctors should look at different alternatives, so surgery for example. Healthcare providers can also provide emotional support, so not only to the child with epilepsy, but to their parents and siblings as well. And they might be able to put families in touch with local support networks and organisations like Epilepsy Action. It could also be that they are able to liaise with educational professionals so that schools understand the needs of children with epilepsy and can support them to achieve at school. If people want to get in touch with Epilepsy Action, they can do so via our website, which is epilepsy.org.uk. We also have a free phone helpline, which is 0808 800 50 50, and people can connect with us through social media as well, so on things like Facebook and Twitter. But if they go to the website, it's all on there.
As we've seen, most children and young people with epilepsy can enjoy a full and active life. With a few sensible safety precautions, they're able to do everything that their friends do. Sometimes, however, epilepsy is more complex, and children and young people need specialist help and support. While research has led to many advances in understanding and treating epilepsy, there is still a lot of unanswered questions about how and why seizures develop, how they can best be treated or prevented, and how they affect other brain activity and brain development. Researchers are studying all of these questions. They're also working to identify and test new drugs, devices and other treatments for epilepsy, and to learn how those treatments affect brain activity and development. Their findings may lead to a better understanding of epilepsy and how it could be treated. I'm Georgina Burnett, and you've been watching NHS Advances in Childhood Epilepsy.